people asked about capnography, end-tidal CO2, what even is it? Capnograph is reading your end-tidal CO2, so your end-tidal carbon dioxide at the end of each breath. So it's monitoring how much carbon dioxide is being exhaled. The technical term for that is end-tidal CO2 or end-tidal carbon dioxide refers to the partial pressure or concentration of carbon dioxide that is measured at the end of an exhaled breath. The normal end-tidal CO2 for a healthy dog or cat is usually between 35 and 45. End-tidal CO2 is pretty kind of critical when it comes to ventilation and detecting if we've got any hyperventilation or hyperventilation, if your patient is too light or too deep. End-tidal CO2 can give you a lot of information in that regard. Using an end-tidal CO2 component in your monitoring equipment is also really important when it comes to making sure that your patient's being tubed properly, that the endotracheal tube is sitting where you want it to sit. If you have constant kind of the readings are all out for that, that might be that the tube has been inserted too far or not enough and it might need re-intubation. If you do have a really low reading constantly, it might mean that there is a hole in this line. So look at changing, swap it over to another and just test if you're still getting the same reading. One thing a lot of people don't realize with your end-tidal CO2 is that you need to calibrate your sample line. So on your monitoring machine, you will get the option to zero it off. Make sure you're doing that at the start of every anesthetic. So your end-tidal CO2 is going to come up here around this area where your respiratory rate is. You just press on it and it'll give you an option to zero. So you zero it, sometimes it'll take 30 or 60 seconds to zero, just means that it's calibrating that line. Also really important with your sample lines for your end-tidal CO2, so say these are, you can, technically they're a throwaway item, they're a one use, but if you are using a mobile, which most clinics do, make sure that you're storing them uprightly, so you're hanging them up so that they can drain. Because it is a component that the patient is breathing into, we've got respiration in there, there can sometimes be a little bit of condensation that will build up in the monitoring equipment and in the sample line. So you want to hang it up so that it is able to drain out overnight and between kind of your patients. Being really careful with these ends of these sample lines, they can be quite delicate where the plastic hits the line, and I've seen these kind of tear, so just be really kind of delicate when you are using these because you don't want to break one and then you don't have one for another patient, but it is always a good idea to have a couple of backups of these. But if you do break it, please tell your practice manager, tell someone, because this might be a really important component of the next anaesthetic that you do for someone that is, for a patient that might be respiratory compromised. And last but not least, really important as well that you are placing your monitoring equipment higher than your patient. Just when it comes to, especially with the respiration and things like that, you don't want any fluid in the lines tracking back up to your monitoring equipment. So this needs to be elevated a little bit higher than your patient. One of the common things that you'll be asked, say if you're in charge of ordering a monitoring machine or you have anything to do with the monitoring machine, you might be coming across the question, is your capnograph a mainstream or is it a side stream? I wish I had an endotracheal tube, that would have been really good. But anyways, so first off, I'm just looking at a mainstream component. So a mainstream capnograph, the component of it that's reading the patient's end-tidal CO2 is close to the patient. It means it's a part of your breathing circuit pretty much. So the computer component of it, the reader, is here, and it's going to attach to my breathing circuit, and then the other end is going to attach to my endotracheal tube, which is tubed into the patient. So I would have this ready in your surgery, all attached to your breathing circuit just like this, prior to anaesthetising your patient. So when you bring the patient in, hook them up, it's all reading, it's all ready to go. So you just attach it on like this, and that is your monitoring component, mainstream, right there. With a side stream, it's a little bit different. You can also get the mainstreams in ones that come and they just attach onto your breathing circuit. They don't have any kind of wires, they're portable. There's some that are called an EMA, and it's like a blue and green little machine. So that is a mainstream version. Looking at a side stream version, this is a sample line. So this sample line attaches to my monitoring machine here, so it's got a little side stream. So this is like the computer component that gets that reading. I'm just going to plug that into here. So that's attached, And you can have that. Sometimes you can attach it, or you've got a part on your anaesthetic monitoring trolley where it will actually clip onto. And so the end of the line then comes down and attaches to my breathing circuit and to my endotracheal tube. So this is called a side stream. So I would think of this as this is side to the monitor, and the other one is main. It's attached to the patient.